Welcome everyone. Thank you for joining us as we discuss cancer care in the time of COVID, challenges in community oncology. I am Dr. Ranju Gupta, a hematologist and medical oncologist with Lehigh Valley Health Network.
And I am Mary Kay Altmiller, a registered nurse at Lehigh Valley Hospital in the hematology oncology office practice, working as Dr. Gupta's partner nurse.
So the first question that was posed to us was, how are you managing your patients with cancer during COVID-19? So the COVID-19 pandemic has definitely brought a lot more challenges for us. We as providers have taken one of the options where we have divided our providers, including our APCs, into two teams. One team is working in-house, while the other team is working at home and doing visits by phone or video. We rotate every week. We review each patient's treatment case by case. We try to do that ahead of time and then decide whether we should delay or skip treatment for stable patients. So a lot of those, the examples I can give you are patients who are getting immunotherapy for their cancers and have been stable for many months. Those I feel very comfortable in delaying or skipping a treatment. We are really trying to put in a lot of effort to think about the risk of the patient coming to the hospital to get the treatment, to go to the lab, to get the lab work done, and the benefit of getting the treatment at the scheduled time, and what the delay in their treatment would mean to them. Another example would be of the bisphosphonates, like the zoledronic acid or the fulvestrant that we give in some of our metastatic breast cancers. So these can all be delayed or skipped in stable patients. We are also delaying the labs and scans to be done in our patients. And we understand that patients are very anxious about their cancer and their cancer getting worse. And at the same time, they're also anxious to come to the hospital to get their tests done, to come for chemotherapy, to come for other treatments. So we in our institute call our patients personally. Either I would call my patients or my nurse would call, and we would explain them the reason why we are delaying it. And we would actually talk it through and see what they would feel comfortable with. Are they comfortable with delaying their or skipping their treatment, or do they insist in coming to get their treatments because not getting the treatment makes them anxious? At every phone call that we do or a video visit that we do, we talk about social distancing and hygiene. What is your perspective on this, Mary Kay?
The doctors are making a treatment decision, but as a nurse, I'm relaying information about risk. Patients are calling every day asking, am I at more risk? A lot of our hematology patients who aren't necessarily immunocompromised, but they're scared. They're not sure. And so we're doing there's a lot of emotional support being provided, and rescheduling and working with the rest of our team to get people scheduled at appropriate times and at appropriate sites. As far as testing and things go, a lot of patients are asking, why can't we just set everything up to be done at home, and explaining that we just don't have the services to be able to accommodate all these patients who have normally been in inpatient or outpatient settings for their treatments to be done in their home. There's just not enough home care providers to do that, nor would insurance companies necessarily agree to that kind of change in treatment plan.
So the second question that was given to us was, what are your greatest concerns in standard care delivery? And this is outside of things like access to PPE. So from my perspective as a physician, I am constantly dealing with the question in my mind as to the optimal care to my patients in a very timely fashion. So my concern is that if I delay their treatment, am I going to put my patients at risk and provide them suboptimal care? We have already started changing the order of treatment in many cases. For example, in our breast cancer patients, those who have been diagnosed with slow-growing hormone receptor positive breast cancers, instead of having them go for surgeries right away, we have started giving them anti-estrogen treatment to buy some more time before they can go for surgery. As everybody is aware, surgeries have been put on hold at most institutes to save the PPE and also to protect our patients from getting exposed to the infection. So we are always thinking case by case, would that decision to delay their surgery going to affect the impact on the patient's overall outcome. Same way in patients who have metastatic cancer, we are discussing and thinking about the outcomes of the patients if we delay their treatment, skip their treatment. Sometimes we are changing the treatment with maybe an oral medication. And then the concern is, would that mean suboptimal outcomes? And a lot of things as we go into further into the COVID-19 pandemic and more time is going by, our societies are coming up with some guidelines and recommendations to help the oncologist, whether they are medical oncologists, radiation oncologists, or surgical oncologists, deal with these issues on a daily basis. The American Association of Breast Surgeons just came with some guidelines last week, giving a little bit more concrete guidelines as to when we can delay their surgeries, when we could start the patients on preoperative treatment with either anti-estrogen pills or chemotherapy, how long we can wait to start the radiation on the on our patients, especially because for the radiations, patients have to come every day, Monday to Friday, for a couple of weeks, which means that many more chances of getting exposed to something in the hospital. In the hospitals, you wouldn't believe that how much clean the hospitals are. The cleanliness is, at its prime right now. All the places where patients are coming or family members are coming are being cleaned multiple times after every visit. Visitors are not allowed to come to with the patients in the infusion areas. So those things are helping us kind of make decisions every day. The other issue that we are having is, even though the coronavirus pandemic is going on and surgeries have been rescheduled or postponed, new diagnosis of cancer is always happening. So we always have patients diagnosed with new cancers, and they're already anxious about their diagnosis and their treatment. And now in this era, we are doing a lot more telehealth, and we are discussing their diagnosis with the patients either by phone or by a video visit, which is not the same feeling like you would get when you're doing a face-to-face encounter in the office. It just doesn't feel right. Even though you can see on the video, you can't hug them, you can't support them, you can't hold their hands, you can't explain things as you would do in the office, and that is another challenge that you have. Last week, I had to do a hospice talk with the patient and his wife over the phone. This is an elderly couple I've known for a lot of years, and that was hard. It took a lot of emotional toll on me, not being able to give the patient a hug or to hold their hands and explain why we were doing that. So it kind of causes a lot of sadness as a provider in me, as a physician in me. We have to constantly think about what is the risk of the COVID-19 to my patients. We have some small literature from China, since that was the first country where the pandemic started, and that shows that the cancer patients, because they're immunocompromised, they have lots of comorbid conditions, are at a higher risk of getting the COVID-19 infections, and if they do get the infections, they're also at a higher risk of developing complications from the infection. So constantly you are thinking about the risks and benefits of treatment versus no treatment. My other concern is that right now I am not seeing my patients. My schedules are not full as they were before the pandemic started. But once this settles down, how am I going to see all my patients in an appropriate timeline? How are we going to accommodate high volumes? And that is one of the reasons why there is a big push for telehealth. But at least, you know, you are connected to your patients, you can talk to them, you can see them, you can discuss their results, you can discuss their management plan. So this is a positive that has come with the telehealth. Another thing as a physician that I am concerned about is that when we are doing these televisits, you're not able to see the patients or examine them. So I'm always concerned if I'm missing a symptom or missing a sign like a swelling in the leg, and patient may have a clot in the leg, and am I missing that? But again, we have to work with the technology. We have to do the best we can in these unprecedented times. We have also reduced the frequency of our lab work and the scans. And again, there is a potential to miss the findings. Mary Kay, what are your challenges from a nursing point?
Well, as an oncology nurse, my biggest challenge has been not being able to be face-to-face with my patients, not working in my own workspace, you know, being able to run things by my colleagues. Also not being able to comfort the patients in the way that I'm skilled in doing, having more than 30 years of experience. When you sit down with a patient for bad news, it's sometimes just a touch of the hand can make all the difference. And we're not able to do that. We're not able to provide the celebratory hug when we get to give good news, which, you know, that's how uplifting for us as well as the patient. You just don't get to provide the hands-on that I've been used to doing in most of my nursing career. That hospice, you know, trying to talk to people about setting up hospice and to hear the tears and not be able to wipe them away. You know, nurses by nature are hands-on people. We like to touch. We like to be, you know, intimate with our patients, and it's hard to do that from across the room. You know, the patients understand as best they can. I had a young man yesterday who kept saying, "I just wanted to give you a hug." So as he walked out, we bumped elbows just because he really felt like he needed to give me some kind of contact. It helps alleviate it will help alleviate their fears. I'm also struggling with the same kind of things that Dr. Gupta had mentioned, as, you know, we're delaying tests and we're not doing blood work, and I wonder if we're trading one illness for another. It's unprecedented, and these are really tough decisions that Dr. Gupta has to make, and we're just trying to support the patients as we make them. And the same feelings of what am I missing on the phone when I can't see you and be with you, especially when I'm doing education with patients. You know, I'm uncertain if people understand as well when we're just talking over the phone. And then have to weigh the risks and benefits for every situation. You know, we have lots of elderly patients but we have lots of elderly patients who don't have a lot of comorbidities, but I have young patients that do, or we have young people who have young families at home, and are we bringing them in and having them bring something home? There's so much, and we're doing our best, and, you know, we pride ourselves on a high standard of care, and used to really being confident in what we know, and that's changing daily now for us. So, this virus has changed the way we're doing things. We just are figuring it out as we go along.
And even Mary Kay, when they ask us, is it safe for me to go to work? And what are the guidelines? And there are no guidelines, right? And so we have to know what is the risk in a patient who has completed his or her chemotherapy 3 years ago versus obviously the patient who's undergoing chemotherapy right now, right? So we have to kind of really make it up as we go and get ourselves educated for that.
And that's a frequent question. That's another struggle for people. People need to work, they need their income. And do I not go to work? Am I keeping myself safe, but am I also costing my family their income? So, it's again, all these new challenges for us. And finally, one of the hardest things is we're working with partial staff. I'm part in the office, part remote. I'm a creature of habit. I like to be in my own space and know where my things are and where my list of phone numbers are. Every day I'm saying, I'm a nurse. I need to be with people. I'm learning to do it differently. My role can be done. And from a remote situation, I wouldn't want to have to do it every day. It just doesn't feel like it fits right.
So the other question that we had was, since these challenges are not one size fits all, what are you personally doing differently? So I'll kind of take the first take on this. So like we talked about already, learning telehealth in a rush. Nobody prepared us, a couple of weeks ago that, in 10 days now we will have to be doing phone visits and video visits. So we really had to learn it on the go. I think that has been one of the biggest challenges to, kind of how to do oncology care, which is so intimate. And like Mary Kay said, holding hands, crying with the patients, celebrating with our patients and their families, and how to kind of go from there to completely digital telehealth was a very quick change that we had to all adapt to. And I have to give credit, not only as a healthcare professional, I had to do it, but our patients and our families had to do that too. So I kind of give them a lot of credit that they adapted to this also just as quickly as we had to adapt to it. Rearranging my routine to the new normal, my new normal, right? Just like Mary Kay is saying that we are creatures of habit. So getting ready in the morning, coming to work, going onto your computer, chit-chatting with a few of your nurses and co-workers, and then starting your day, going for tumor boards, going for other journal clubs, all of that has changed. We are now not holding any tumor boards in person. We are contacting each other through our phones or through the Epic, and then kind of dealing with case as they are coming, working sometimes from home, working sometimes from at work. Even at work, some patients I'm seeing them in person if they're getting chemo. The others I'm doing a phone or video visit with them. And so learning and kind of rearranging to my new routine is different. I feel like sometimes I'm spending a lot more time out of work, doing the work, in the sense that I'm going on to my schedule 10 days from now, 2 weeks from now, and trying to say, oh, does this patient need chemotherapy, not need chemotherapy? If I'm not going to do the chemotherapy, I need to have a phone call conversation with them so that I can even tell them not to go for their scans or their lab work. So those are kind of things that you're spending a lot more time, not face-to-face with the patient, but still spending time thinking about your patient doing that. Trying to stay calm during all of this is another challenge that you have to accept. What do you think, Mary Kay?
So I think the challenges are going to continue and are changing as this goes on, as restrictions get tighter. I know my house is the cleanest it's ever been. I'm much more fastidious about making sure that every surface we're coming in contact with is cleaned. When I can, I'm getting out and walking and getting in the sun. It helps to decompress. It's very stressful when we're not only the decisions we're making, the relocating, the working remotely, all these things cause a lot of stress, and it's good to get out and decompress. The other thing I find is I'm spending a lot of time with just doing emotional support for my family and friends. And I are nurses, and people reach out to us for advice. We've decided to hold a neighborhood meeting. We live kind of suburban to rural. Our neighbors are not close, and so we tend to wave to each other when we're cutting the grass. So we decided that it would be important for our neighborhood to know each other a little better, exchange phone numbers, and let people know that they could reach out to us if they needed something, or we to them. And so, of course, we did that, maintaining our social distance and in the great outdoors. But it was very nice, and I think that that those kind of, we're going to see a lot of those kind of changes overall in how people interact with each other.
And even using the PPE in the office, right? So kind of we have to wear a mask, you have to wear gloves, and those recommendations are constantly changing as new information is coming by. So trying to kind of adapt to it, trying to learn wearing the eye goggles or an eye protection, and so all those are also challenges which are new. We have not used these unless we are doing a procedure. So those are other challenges I feel that are also there. We are always kind of contacting each other if we are working remotely by phone, so that we can do all the discussion and all of the things can be done in real time. So the next question is, how are you managing work-life balance with considerations like spouses working from home, children homeschooling, and shelter-in-place rules? I think any one of us can talk about it for hours, and a lot of commonalities would be there no matter where you are in the nation. Both me and my husband are physicians. So one of the things that has really caught me is the anxiety that we both go to work, that we could catch this either at work or outside of our work, and we could bring it home no matter how much clean practices that we are doing. And then what happens if we give it to our kids, and how much social distancing you can do in a family of four. We fortunately do not have any older folks staying with us. And I have had discussions with some of my friends, especially those who are in New York. And it was very disturbing when one of my friends was talking about, what if one of us dies? I mean, those are discussions that we have not thought about. We really don't want to go there, but are relevant in today's world. I mean, COVID-19 has been a great equalizer, can affect and really have bad consequences for any one of us. Other kind of things which are not as big like, and loaded like this is children being at home. A lot more food needs to be brought, prepared. We are cleaning or laundry, especially kind of, bringing clothes home from work. Add on to this that no help is allowed to come home, no cleaning ladies are coming home, which means that all of the work has to be done by us. Keeping the children occupied, since they have no way to go on play dates or socialize either, has been challenging at times. Trying to maintain a routine. To me personally, some positives have come by. One of our ex-nurses has started kind of movement here and has gathered more than 600 sewers, and they are sewing masks for the community. So I have been involved with that. I've also tried to kind of help food pantries in the community to do some kind of work over there. What about you, Mary Kay?
Well, as I mentioned, my husband and I are both nurses. He works in critical care, so our experiences are very different. And it's hard. We're trying not to make the virus the center of our lives. He comes home from work, I come home from work, we work different shifts, and then we're comparing notes, and it just can become overwhelming. So, we talk about it, and then we try and have some real life and spend time together. We've had to refrain from visiting my mother-in-law because both of us know that we're very highly potential to be exposed, especially my husband, which is challenging because she lives alone. We're relying on other family and neighbors to meet her needs and check on her because we want to keep her safe. So that's a challenge. And then working at home on a rotational basis with my nursing team. Fortunately, at our site, we're a rather experienced group of nurses, a little bit older, so we don't have a lot of young children that we're contending with among the nurses. So that it's easier for us to accomplish our work when we're at home. Only thing I have bothering me is the dog. But our coworkers are having more challenges with their, children trying to do homeschooling with their children, and we're doing the best we can to support each other. As I said, it's stressful for us to work at home, especially for me. Some of my colleagues like it better, but it's not a good fit for me. So we're just not trying to make my work hours be work, and the time that I have with my family, my husband, and talking a lot to my son who's in the service. And we talk a lot more on the phone. They're quarantined also, so trying to keep each other calm and remember that there's life outside of this that we have to remember we're going to get back to.
And it's very hard sometimes, not sometimes, but always, all the co-workers would like to sit together and have lunch at least together, right? So now we can't do that. Even at, lunchtime, you have to maintain the social distancing. And it's hard not to be able to interact, to kind of talk about our lives, joke around. Those were de-stressors for us, and we can't do those things right now. So no matter how much sometimes you try, the COVID-19 or the virus will always come into the conversation. You put the TV on, and that's kind of what they're talking about. So it's there in your face, no matter how much you try to avoid it all the time. What is one positive thing that you are taking away from this crisis? I think I have more than one. I have really learned to cook new things because, like I said, we are doing all meals at home. So I have to be innovative. So sometimes I'm cooking Indian food, at other times Chinese food, sometimes like Mexican food. So trying to learn new recipes has been challenging in a good way. I think I'm getting a little bit better at that. Obviously spending a lot more time with my kids. When I was working remotely from home last week, my kids were very happy. My daughter was like, "Mom, this is really nice. Can't you do this on a routine basis?" From 12 to 1, when I did not have a patient, I was able to fix some lunch for them. So that was very nice. I've never done that in my more than, since my med school. I started in 1990. So it's been a while that I have done that. A lot more cleaning has been done, since not only are we not having our lives in the hospital, we are not visiting anybody, or nobody's coming to visit. So all other activities outside of work have also been curtailed. So many closets have gotten clean in the past 2 weeks. I am spending a lot more time spiritually in meditation and prayers, and that kind of really calms me down the most. Um, Faith has been important to me, and I think that I'm relying a lot more on that than I did before. I also feel like a camaraderie, and believe it or not, as remote as we are, I feel like I'm more connected to a larger community of physicians, nurses, other healthcare workers, not only in my own hospital, but all over the country. So if something happens to another place, another hospital in New York, I'm worried about that. I'm praying for everybody. You feel like those stories, you can connect to them. So I think that connection is there somehow. And I feel like once this is over, we all can join together to celebrate that as a nation, not only as one small part in that nation. Um, Mary Kay, your take?
I find that, and we've always known, but one of the really positive things that's coming out is how innovative and resilient healthcare workers are, from the doctors to the house cleaning staff and everyone in between. When we don't have what we need, we figure out how to make it. We do our best and continue. I see all kinds of innovation. I remember years ago when I worked in laminar airflow, we used to put pumps and things at the door. Well, that's I see that happening now in hospitals, so saving trips into the room, and it just taking devices and making them used for something else. And even as the nation, are the factories that are switching over from making cars to making ventilators for needs. Healthcare is always moving, and I think the way we have come together in this crisis and do the best for people that we care for. I'm really proud of our team at Lehigh Valley. Everyone's come together. They're working together. It's odd to come into the hospital and get your temperature taken and then go upstairs and repeat it and report it to your colleague who's collecting the data for the managers. But everyone's doing what they need to do so that we can get to our patient care, which is what we're best at.
And I would second that, Mary Kay, that really, this is what we have been trained for, to take care of patients, through thick and thin, whether there is crisis or there is no crisis. And this is what we are best at doing. And if things are not a straight line, then we figure it out, we figure it out as we go. And I'm very proud to be a physician in these times. Yeah, sometimes there is anxiety and stress, but that's kind of part of the work. But still, kind of makes me feel get up in the morning and go to work and take care of my patients. Innovation, yes, absolutely. The other day we were looking at making shield with a mask with the strings and the dividers that you use in your binders. So I've ordered some from Amazon so that I can get them and make them at work. So innovation will come. We are all trying to learn to do things more efficiently and in a different way. But this is all the teamwork is all about. What is something important to you right now? So something that is really important to me at this time is optimizing the care of my cancer patients. So they are first and foremost in everything that I talk about, think about, is my patients, so that I'm able to give them optimal care, whether it is delaying their treatment, whether it's giving their treatment. So that's my first and foremost thing of importance. I pray and hope that our family remains safe. My family, as in my family in my home, and also as my family in my place of work. All my co-workers, my physicians, managers, everybody stays safe. I am very scared that my patients who are doing well from their cancer, they can that I would lose some of my patients to COVID-19, and that scares me a lot. And in between all of this, I'm really trying to keep my sanity and my positive attitude and believe that this will end. And hopefully this will end very soon.
Yeah, I think some of the things right now, it's so important for us to stay calm and stay informed. The information comes at us just at lightning speed, and we have to, adjust and change our sails at a moment's notice. So I think it's very important that we stay calm, and we just can't help our patients if we're running around like the chickens with our heads cut off. We transfer that anxiety to the patients and to the others around us. So I think it's important that it's really important that each individual is able to maintain their calm and focus on moving forward. One of the things I find is that people are looking to point blame, and I don't think there's a place to point blame at this point in time. Plenty of time to discuss that when the crisis is over, but right now we just need to focus on staying calm, getting the information out to people, protecting each other, protecting our patients, and providing the best care possible in the situation we're in.
What are a few COVID-19 takeaways that you would like others to know? So I think that first and foremost, I would like people to know that patients with cancer are more susceptible to getting COVID-19 and that they are more likely to get complications from the infection. I also want to know that oncologists have to make a decision about along with their patients and their families and discuss the risks and benefit of continuing their chemotherapy or immunotherapy versus delaying their treatment. And this has to be as a cohesive decision between the physician and the patient and their families. We cannot forget that we need to take care of ourselves and our families too. Just like when we are traveling by air, and they do all those, safety checks, and they tell you that first you have to give the oxygen to yourself before you give the mask to the other one. So we got to remember that we got to sleep well, eat well, get the support that we need from our family members or our co-workers, so that we are taking care of ourselves. This can cause a lot of stress and anxiety amongst all the healthcare providers, physicians, APCs, nurses, and we got to take care of ourselves. It's okay to have joy with your family. Just because somebody else is not doing well, and there is a bigger crisis in one part of the nation, does not mean that you have to refrain from having some joy in your life. We got to count our blessings. But we also have to understand that we got to pass the blessings to other people. So we have to help the less blessed ones with food, money, or whatever else they may need. Just talking, just checking on the friends, and making sure that everybody is okay.
So my takeaways are I agree with everything Dr. Gupta said, and not to be redundant, I went a different route. So my takeaways were that we as a nation need to be more prepared for this kind of crisis. This was not unforeseen. People had been talking about it. Supplies, staffing alternatives, communication. In our global world, we should expect that these situations are going to arise, and we've learned a lot already. And next time we'll be more prepared. But we should hope there won't be a next time, but in reality, there will be as people interact around the world. So we need to be more on target as to what we have to do in these kind of health crises. We need to also make sure that people are getting good information. I have people, calling, they read on Facebook or they saw on, on social media some bad information that's making them scared. And so, I mean, it's scary, and there's a lot of scary real information out there, but you know, the COVID virus is not a pink eye, and or some of the, I've heard odd things. I mean, the most common thing is the toilet paper scare, but just so that we can direct people to good sources of information. And my final takeaway is, as I said before, the medical community rises to any challenge. You know, we support each other, we support our communities. I'm still interacting with my original nursing colleagues who are in New York, in the epicenter of all of this. Their takeaways are going to help me in a week or two when we hit our peak. So I think, you know, our support of each other, and we really are, even though we're a huge nation, we really are one medical community that tries to work together to give each other the best support and knowledge that's out there.
Thank you all for taking the time to help us navigate cancer care in the time of COVID-19. Stay safe, and again, practice social distancing.